So transient incontinence is a type of incontinence that appears suddenly. So you have somebody who actually was having no problems with their bladder function who all of a sudden is having loss of urine. And they may or may not be reporting it depending on what their health status is, but certainly the CNAs that you work with should be observing for this as well. And transient incontinence usually has a treatable factor. There's usually a reason why it's occurring. And sometimes it can be because there's a change in mobility. Sometimes it can be related to changes in fluid intake. Sometimes it can be the addition or the adjustment of different medications. So the one that comes to mind most readily is diuretics. You increase or you add a second dose of a diuretic, and now suddenly someone's having trouble with getting to the bathroom in time. We see the same thing with pain medications and sedatives, making it difficult for people to get to the bathroom. It's really important to identify these changes as soon as possible, because what we know is that if transient incontinence goes on for more than 6 months, it's much harder to reverse or improve, and the prognosis in general is lower. It's interesting to note that in one of the studies of 53 nursing homes that the investigators identified potentially reversible causes of incontinence in over 80% of the residents. So this is a very treatable thing that nursing needs to be particularly cognizant of. So how do you keep those contributing factors or risk factors for transient incontinence in your brain? Well, this is an acronym called DRIP. And think about the D's. So if we have somebody who's had a change in health status and they're experiencing delirium, or their dementia is progressing or becoming evident, that certainly could contribute to this. Now, diapers is on there because one of the things that oftentimes happens is that in nursing homes, when patients are admitted, continence is not fully assessed, and patients are automatically given a bed pack for their room that includes a pad or a brief. And so what's happening is you're sending this resident the message that toileting really isn't supported in your facility, but rather using a pad or a brief is really how we want you to handle your bladder function. And some of our residents really embrace that, and it becomes a reason why they become incontinent. So it's something to keep in mind. Continent residents should not be receiving absorbent products. R stands for restricted mobility. So if you think about someone who has a progression of arthritis, for example, or they've just had surgery with a hip replacement or a knee replacement, that certainly could be contributing. But I also want you to think about retention, because this is the person who doesn't urinate, and then all of a sudden they have a sudden large loss of urine because the capacity, the amount of urine in the bladder is so much greater than what the bladder neck can stay shut. So something to think about there. Also infection. Urinary tract infections are the most common thing that we think of, but I also want you to think about impaction and constipation, because many of our residents do struggle with having regular bowel movements. A lot of times it's related to mobility and fluid intake and dietary intake, but many times it's related to their chronic illnesses and medications that they're on. Also, whether or not there's any inflammatory process or dietary irritants, and we'll talk about this in a minute, but certainly things like alcohol, caffeine, and NutraSweet, as well as very acidic fruits for some of our patients, can be very irritating and cause a loss of urine. And then the P stands for pharmaceuticals, which is also, medications, and also the symptom of polyuria, which we see quite frequently in type 1 diabetes.